Core Measure 5, Active Medication List. The objective of this core measure is to make sure that the eligible provider is maintaining an active list of a patient's medications in the electronic chart. The measure requires that more than 80% of all unique patients seen by the eligible provider have at least one entry or an indication that the patient does not currently have any prescribed medications recorded as structured data. This is very similar to Core Measure 3, which we've previously discussed. This is also on the face sheet, and it requires that it be reviewed at least once during the reporting period, even though it is not an encounter level measure. This is specifically looking at the current medications. The requirements for attestation are numerical, the denominator representing the number of unique patients seen during the reporting period. The numerator, which in this case must exceed 80% of the denominator, is the actual number of patients who were seen that does in fact have at least one medication indicated in his chart in the structured data, or an indication that there are no known medications currently prescribed to that individual. And this is another measure that does not allow any exclusions. Therefore, all providers must demonstrate a higher than 80% compliance with this measure. We're going to quickly toggle into prognosis. And the example here, we have opened a new chart for our patient, a new patient in fact, and you'll notice his face sheet is entirely empty. Since we're talking about the current medications, I'm going to go ahead and click on it. And similarly to what we discussed in video 3, one option is to indicate by clicking the checkbox in the lower left that there are no known current medications. In the case of a new healthy patient who has no current medications, that is possibly going to be the case. However, if the patient does have a medication that has been previously prescribed, then instead of indicating no known medication, we want to click our check mark here next to the drug label. That will allow us to do a search and select of our drug library, and we can simply go ahead and select the drugs that our patient's taking. Now in this case, I've answered just by entering the name Minthosin, and I'm going to save it, but I'm not going to enter any of the drug details. I'm not going to care about the frequency or the duration or anything like that. So when I go back here and look at my face sheet, all I see is the name of the drug, but I don't see any of the dispense or frequency or strength or anything like that. This, however, is still compliant. The measure simply states that we must maintain a list of medications, period. It does not go that added length and say that you need to know the strength and the frequency and the number of refills and all of those additional details. That, however, is an option. It is, of course, of local preference. If you do want to have that type of detail, while you have answered the compliance requirement of the drug, you also can go the added step of going in here to the drug details. And then that is where you can go ahead and add the strength and the dosage and the frequency and whatnot, whatever the case is. As long as you do not leave the cell blank. So, again, to summarize Core Measure 5, we want to make sure that on our face sheet in current medications, you are entering at least one or more medications that the patient has been prescribed, or, if applicable, indicate that there are no known medications by clicking the checkbox. And we want to make sure that we are marking the face sheet cell as reviewed at least once during our reporting period. The main objective is to make sure that you are not ignoring the active medication list on the patient.